the x-ray shows a badly deteriorated left hip cartilage, almost to bone on bone, but not quite there. I had a pronounced limp, and the walking became pretty much step-by-step pain, and only got worse as time went on. So when I went in June of '07 for the surgery, I was definitely in pain to walk. Well, I was 61 years old when I had the surgery, and my prominent memories are reporting to the hospital that morning, 6 o'clock, going through the pre-op procedures, and being wheeled into the operating room. That was about my last memory. But the real memories are the complete lack of anything that struck me as being out of the ordinary. The whole procedure, once I woke up in the recovery room, everything else was just absolutely flawless. I was experiencing no pain of any type, no dizziness, no nausea, and I was kind of prepared for the worst, and everything was the best. I reported to the hospital 6 o'clock in the morning and was discharged from the hospital at 5 o'clock in the evening. I chose same day because in post-op, sitting in the recovery room and then sitting in the private room, I didn't see any reason to stay. I had no pain, I had no dizziness, I had no nausea, and felt the best place for me was probably to go home. Even though I could have stayed, and I realized a lot of patients do, I just didn't see a reason for it. I felt like I didn't have the surgery. I felt like I normally feel pretty good, so I didn't see any reason to stay. Before I left, I was given a cane, saw no reason to use it, had no pain or discomfort or even lack of mobility. I felt like I could walk out of the hospital, so that's what I did. After the surgery, my employer suggested a couple of weeks. Basically, I had the surgery early in the week, and I was back to work the following week. I was not driving a car as probably I normally would, but I was back to work, walking around, and full time. So within a week, I was doing my job like I normally did. I have never used a painkiller to this day, starting from post-op to this day. I've never even taken an aspirin for the hip situation. It's now certainly almost a year later. I am riding a bicycle probably 20 miles a week, walking where I want, going up steps where I want. I'm in sales, so I'm out in public. I travel on and off airplanes. I'm doing everything really I have to do that I did before I, started to feel the pain. So I'm actually very active. I have no pain. There's nothing I don't attempt to do because of the hip.